Okay, so I'm going to go ahead and administer the piggyback of the antibiotic. First of all, I'm going to gather all my supplies, review my order for Miss Ellen Davis, and make sure that it verifies 50 milliliters of cefazolin 1 gram over 30 minutes every 8 hours. Okay, so I went ahead and gathered that. Here's my cefazolin. It's already been mixed previously into this bag. I'm going to go ahead and verify that the solution is clear. There is no solute matter. You want to make sure when you are mixing medications that you get those mixed very well, no crystals. And if it is, looks not clear, the color's not clear, and it looks like there's solids, you discard the bag and notify the provider, and also get another bag drawn up and administered. Okay. All right, so I'm going to enter the patient's room. I'm going to knock on the door and make sure there's privacy for her. Perform hand sanitization. Introduce myself. Good morning, Ms. Davis. This is Leslie, your RN, and I'm going to administer a piggyback, which is a secondary medication that's going to be given in some IV fluids through your primary line. Dr. Jones would like for you to have cefazolin. You don't have any allergies to penicillin, correct? Okay. And then I'm going to verify that your name and date of birth and the allergies are listed on your name band. And if the patient is cognitive and can read and verify that back, we can do that together, okay? All right, so I'm checking my IV site. I've placed this on hold. I've closed this off. Checking my IV site. I've flushed it just to make sure that it's patent enough. There is no redness, tenderness. The patient is not complaining of any discomfort or coolness. I don't see any edema. No signs of phlebitis where there's any kind of oozing or signs of infection to the area. I'm going to perform hand sanitization. And on some gloves. And while I'm doing all this, I'm just going to perform some teaching on the patient to let her know signs and symptoms to report while utilizing this medication. Make sure that she doesn't have any type of liver disease, any kind of stomach or intestinal issues like colitis, Crohn's disease. Make sure that she does not have an allergy to any kind of penicillin. Make sure she is not breastfeeding. Then I'm going to advise her on the signs of anaphylaxis dyspnea, increased dyspnea, wheezing, swollen throat, tongue, a rash to the side of any sort or anywhere on her body. I'm just going to remove the IV tubing. I've got the correct one. It's 10 drops per milliliter. And we also have this, in which the primary bag is going to be hung on this. Okay, that's going to allow for the administration of the piggyback. Just going to hang this lower for gravity. There's that one. All right, here's my IV tubing. Make sure there's no kinks in it. I'm going to go ahead and open my IV bag. I'm going to let her know to advise of any increased heart rate, chest pain, decreased urine output, swelling to her extremities. Those are all side effects that need to be reported pretty immediately of the antibiotic cefazolin administration. I'm going to remove the cap. Then I'm going to go ahead and insert. Make sure this is closed. Don't lose any of our medication. So I'm going to administer prime this tubing very slowly. I'm using the cap, go into that. Be real careful because we don't want to lose any of this medication. Real slowly. going to retap it. All right. And you're going to check for any bubbles, okay? I don't have any, but if I did, I would make sure that I advance them upward. Back into the port. Okay. All right, so you're going to clean your IV port site. And you're going to administer this secondary to the port closest to the IV site. Okay, so that would be this one. You're going to cleanse vigorously for 10 seconds with alcohol swab. Remove the cap, discard. This, the primary clamp. That way we have proper administration of the piggyback. So we're going to go ahead and I've already calculated the drop factor. So we have got 50 milliliters to administer over 30 minutes, and the drop factor is 10. So that's going to give you a drop factor of 17 drops per minute. I'm just going to use my watch, and I'm going to calculate the drip factor this way. To that 17 drops per minute, you're going to go ahead and let that run over 30 minutes. And I'm going to go ahead and label my bag with the IV solution, which is acetylzolin. Patient's name, Miss Ellen Davis. The date today, my initials. Prescribed rate, which is 50 milliliters over 30 minutes. And the time that I started it, which is 1:05. And it should finish around 1:40. 1:35, excuse me. We'll finish around 1:35. And I'm going to label my tubing with the time and the date and my initials. And I also like to put the drop rate on there, the tubing as well, as 17 drops per minute. So I'm going to clean up my area, make sure that Miss Davis is feeling okay, that she's getting that going in, and check the site again, make sure there's no inflammation, no redness, no coolness to the touch. Perform hand sanitization. You're doing well, okay. All right, if you start feeling any kind of chest tightness, wheezing, I'm going to assess your vitals frequently. I'm going to check your lung sounds, check your IV site, check your extremities for any edema, make sure you're not getting a rash of any sort. Please report any of those to me so I can report to the provider, okay? All right, and that is the end of that video.